Did you know that diabetes and complications from diabetes kills more people in the US than AIDS and breast cancer combined? On today's episode, we will highlight 2 diabetic emergencies that can be deadly. Stay tuned. Dr. JB, Dr. JB, Dr. JB in the house. Hi everybody, welcome back to my YouTube channel. It's Dr. JB here. If you like or find value in what I am presenting on this YouTube channel, do me a favor, like it, subscribe, and share it with your friends and loved ones or anybody else you think might find value or enjoy the content that I have on this channel. November is Diabetes Awareness Month, and on today's video, we are going to highlight 2 diabetic emergencies that I see all the time in the emergency department. The first one are patients with low blood sugar, and the second one are patients with high blood sugar. So let's get started. Low blood sugar is defined as blood glucose or blood sugar levels of 70 milligrams per deciliter or less. When your blood sugar levels start going down, some symptoms that you might experience include feelings of shakiness, feel a little anxious, you start sweating a lot, you can start even slurring your speech, you start feeling really tired, and you can become unconscious or go into a coma. If you are diagnosed with diabetes, the most important thing to have is a glucometer in your house. A glucometer is what you use to check your sugar levels. So if you start having these symptoms, it's important to see, what are my sugar levels? It's a little finger prick and you get a little drop or 2 of blood and it tells you what your sugar levels are. If your sugar levels are less than 70, then it is extremely important that you have something sweet to drink or eat. So that's when you reach for your orange juice or apple juice or a piece of candy or something to quickly bring up your sugar levels, and then you go to your local emergency department. The second emergency that we see all the time are critically high sugar levels. So critically high sugar levels are defined as blood sugar levels greater than 600 milligrams per deciliter. So when your sugar levels start to get elevated, symptoms that you will experience are you are going to be peeing all the time. And that is because when the sugar levels in your blood get too high and your cells are not able to reabsorb them and they're just hanging out, partying it up in your bloodstream, your body has to get rid of it. So how does it get rid of all that excess sugar? Well, it's through your kidneys. And so you start peeing and peeing and peeing a tremendous amount of urine to try to get rid of all that sugar. If somebody were to test your urine, they would see that you have a lot of sugar in your urine. But what happens when you pee all the time? Well, you get dehydrated. And so that's where the whole, oh, I'm so thirsty, I'm so thirsty, I'm so thirsty comes from, is because you're peeing out so much fluid from your body. When you come to the emergency department, oftentimes you will be bone dry. Your tongue will be dry, your lips will be dry and chapped, and those are all signs of elevated blood sugar levels. Other symptoms that you might experience are rapid breathing. And the reason why you will start breathing more rapidly is your body is trying to compensate for that extra sugar in your blood by making you breathe more rapidly. Other things that you might experience would be changes in your mental state. You can be a little bit more confused, you can be sleepy, and you can also go into a coma. Of note, both low blood sugar and high blood sugar can cause you to go into a coma, and both of them can be deadly. According to the CDC, approximately 34 million people in the US have diabetes, but 1 in 5 have no idea they have it. Please don't become a statistic. Follow up with your primary care doctor and get tested to see whether or not you have diabetes, and then discuss treatment options to help you take care of your health. Well, that's all I have for this week. If you enjoyed this video, please like it, subscribe, and share. Until we meet again, stay safe.
Got nothing else to tell. Subscribe and hit the bell. Smash that like button. Dash and stop fronting. Until we meet again, yeah, share it with a friend. Dr. JB is my name and medicine is my game.